Welcome, everyone. I'm Bill Sheckett from the Center for Faculty Excellence. Our presentation today is critically analyzing the significance of dissertation research for social change. We have three people presenting. They are Pete Anderson, Amy Ferraro, and Cheryl Keene. I'm going to go ahead and move to the housekeeping slide. Those of you who have never been into a webinar, this will be new for you. I see some names in here, excuse me, of people who have been here before. In the upper left-hand corner is an area where ordinarily we would have a transcriptionist working and typing out the dialogue as it went on. We've got a tech problem today, so we do have our transcriptionist, but she's going to type everything up offline and provide it later. In the left lower area is a very important area, and it's the chat room. I'm going to go ahead and put something in right now. Type it in and return. And that chat area can be going at any time and all the time. Okay, in the middle, obviously, is the PowerPoint slide and slides for the presentation, and we'll be going through roughly 20 in the next hour. On the right side are the people that are hosting. In this case, it's myself and the presenters, Angela, Cheryl, and Pete, and then below them, those of you who are participating. Again, welcome everyone. And I'm going to now turn this over to our presenters, and let's get it rolling. Okay, I'm having trouble moving this. Oh, okay. Yeah, we should be able to. I forgot to talk about how to raise your hand and get involved at that level, and that means clicking on the upper bar where it shows a raised hand and going ahead and doing that. There we go. Okay.
One of our participants can't see the PowerPoint.
Participants are not seeing the PowerPoint right now?
Okay. And it's blurred right now, but that's on purpose, right?
Yes, right now I made it small. There we go. Okay. We good now?
Yep, yeah. But let's start with our poll while I introduce the seminar. So, friends, this is Cheryl Keene. I'm a faculty member in education, and I and Peter have run a seminar on this, our focus on positive social change at each of the last 3 or 4 biannual or twice a year faculty meetings. And Iris had suggested that we tackle something like this, and it occurred to us that it would be very important to deal with this sort of, we think, is one of the particular challenges of our social change mission is how we address it in the abstract of the dissertation. So we're going to carry on, but right now we want to know who's with us. So if you could check the box.
And they are doing so.
Right, they are. And we might be missing, we're missing a box that allows for our dissertation editor, a staff person. So why don't you should register yourself as a URR if you want to click something. I don't know what happened to our box there. So, and then people have played several roles, it looks like, because we created that option. So we have lots of second members and chairs, but if 3/4 of you are chairs, it means you're really responsible for overseeing this abstract, and the university reviewers and the dissertation editors, of course. So, all right, so we all have our hands deep in this work. So let's move on. And I think we're all familiar with our mission statement, and this is what we're using as the basis of the charge. This, incredible expectation that all of our dissertations have to address this. We wish we had Annie Pizzello with us. She is, Dr. Pizzello is the person that reads now all the abstracts and gives comments on them and approves them. So she was with us in January, and we can share some of her perspectives about how we do this and different ways and different. But this cuts across our schools and our programs, and we hope it'll be useful for everyone. So now, next slide, but I don't have a little button. Amy, have you got access to the button to change the slide? I don't see it.
There you go.
You're doing it. Let me make the box bigger here. So the reason we thought it was good to spend time on this in particular is that we had experienced problems with dealing with this part of the abstract. We've a sense that our students have actually, I would appreciate if some of you would write in the chat box right now what problems you perceived with this aspect of writing the abstract. Is anything else besides our students being feeling daunted by what they perceive as a difficult task to define the significance of their study? They struggle about framing it not as an activist, but as a scholar practitioner, not thinking through all of who or what might benefit from their findings. We're also we want to talk a little bit about null results and how you might handle that in an abstract. And maybe feeling naive or not paying attention to one's field. And I really experienced what Mary D. just wrote here, the save the world, overstated claims and lofty language, which maybe our dissertation editor could tell us what kind of, if he thinks the prose and agrees that the prose can be too lofty. We hope that after this hour you'll get a sense of how to help students think a little more systemically and not be so declarative or positivist when they say this will happen and naive. And there's Mary D's concern about saving the world, and then struggling with the difference between gap, significance, and social change. We've got maybe everybody can't read the screen, but Donna talks about some research, this basic research without as much knowledge. And what do we do about that in different fields? That might be an important thing. And Judy Forbes talks about not focusing on the results of the research. And Peter's going to address that directly. So moving forward here, now I found my arrow, Amy. So what we want to do is introduce these challenges, which we started to do, and how we think so we might invite students to think more systemically. Make sure that we all know where we can find the guidelines for the abstract that might lift us up in documents we can share with students, and figure how we can support students. And we have a little exercise we're going to look at an abstract without the social change statement and see if we can anticipate what it might be and the kind of things that we take into consideration in addressing it when we all look at the same one. But if you were sitting there with an abstract you think is sloppy or not thorough enough, please start to pull it up in 20 minutes from now. I might ask you to type in the student's attempt, and maybe we can all look at it and sort of use this a little bit of a clinic. So that's our agenda. And if anybody has anything else you'd really like us to do, please write that into the chat box while we're here. And Amy's going to talk about our sort of systemic approach to this. But I hope everybody read Carrie Brown, our editor's comment about Annie, who approves these, telling them to ask students to indicate how the intended audience could apply the findings to advance social change. That's a good exercise. So, Amy.
Sure. Double check. Can you still hear me okay?
Yes.
Okay, wonderful.
Introduce.
Yeah, I'm sorry. I'm Amy Ferraro, and I'm a core faculty member in the School of Health Sciences. I serve as dissertation chair, committee member. You are just like you all. So I've been in the trenches, and fortunately with other folks on this call and colleagues, we've come up with a couple of tools that will hopefully help you and your students figure out ways to expand on their statements about social change. I highly respect the comments about students seem to either go too broad and say, I would like, this will save the world and we're good, nobody's going to die anymore because of my results, or the reverse, not knowing especially if their results are insignificant, not understanding how they can say anything at all about this. So one tool that we'd like to use is thinking of social change in terms of concentric circles, that the results of a study can have influence on many levels. The first being individual factors. That would be the actual participants of the study. Now, if a study is done at sort of a more organization level, this might be slightly, you might have to adjust it slightly, but the first circle then causes a ripple effect on the peers around that individual. So you might think in a health study that would be the doctor-patient relationship. We also might be able to say something about our finding that doctors need to change the way that they approach patients. The third level would be programs and interventions, rippling out into the next proximal level of community factors. Some might also call this society factors. For myself, I often think of community as the local community. This might be like a school or an actual city that somebody is living in. But then society might be the nation as a whole. Internationally, can these results have influence? And then finally, we end with an academic level and how our findings fit into the body of literature and what research has already been done and what can come in the future. So the next slide goes into a little bit more detail about what we would advise students to include in each of these levels. So starting at the bottom would be individual factors, might be anything about changed environment, knowledge, attitudes, or behaviors, or wellness. And I know in the health sciences we can often say about improved morbidity or mortality, saved lives. It might be a little bit different for a business or education study. Peer factors, as I mentioned, might be something like the doctor-patient relationship, but you could also think in the residual effect to individuals' boss, coworkers, friends, family, social support network. And so this is often, I'm going to go back to, I keep falling back on health examples because that's where I draw from, but when we think of infectious diseases, often there's transmission to somebody else. If you're talking an STD, it would be transmission to a partner. So if I'm doing a study that talks about individual factors on condom use, that will have an influence on the partners of those individuals. Now, programs and interventions can include services to the individual by doctors, therapists, and education administrators. We can think about new and targeted programs or innovative interventions and new treatments. Community factors is where maybe policy initiatives will fall under and changes to infrastructure. And then finally, in the academic level, we're talking about how our results can, not our results, our students' results can inform existing body of academic research. So these next two slides actually cover just a summary of what I've talked about. I think maybe the main take-home message would be think about a student's findings, their actual results from their study. That's like a pebble being thrown in a pond, and there can be a ripple effect out from them. And help them to think about where their results might influence these other levels, but also consider that if they're informing the basic body of academic research, that can influence future studies that are done. So even if there's non-significant findings, it might be, okay, my findings show that these variables that I examined are not enough. And so future researchers should look at additional ones. And then also they should consider, again, going back to the audience that they're writing their dissertation towards. It might be academics or actual practitioners or policymakers and administrators. So they might need to frame their statement related to that, and that might be related more to the community factors than individual factors in their study. Okay, and now I'll pass over to Pete.
Hi everyone, how you doing? I'm Pete Anderson. I am core faculty also in the School of Health Sciences, and like Jody, my full-time job is dealing with dissertations. So in the dissertation guidelines, there are three major components that deal with positive social change. One is the abstract, which typically doesn't get written until you've completed your entire proposal and is sort of a summary of all the things you've done. So the notion of making a statement about positive social change in your abstract would typically come after you've written your chapter one. And in your chapter one, there's a section where you describe the potential implications of positive social change, identify the contributors, and identify the contributions of the study to advancement of knowledge in your discipline. After you've done those, then you have a better chance of writing a good positive social change statement in your abstract at the proposal stage. When you move on to your chapter 5, you have another opportunity to talk about positive social change. In your chapter 1, in your initial abstract, you're talking about what the possibilities might be. If I find this, or if the results of my study are what I sort of expect them to be, then these good things might happen. In your chapter 5, you already know the results of your study and what's happened, and now you have an opportunity to talk specifically about what you studied and what might come from that. I always direct my students to talk about possibilities rather than absolutes. So instead of saying things like, as a result of my study, this will happen, I ask them to say things like, as a result of my study, this could happen. And going from there, it's always the potential for positive social change. It isn't absolute positive social change, especially if we're dealing at any level. At the individual level, if we learned that exercise helps reduce obesity, we have no idea if people are actually going to exercise. If at a systems level, we know that this change in how the system works might impact the health of the people that come to that medical center or that hospital, we don't know if the people at that medical center or that hospital will actually implement any of the changes that we might suggest. And if we are in a position where we get to talk about theory, whether or not the results from our study impact the theoretical frame that we used, we also don't know whether or not anyone is going to retest that theory or revise that theory based upon the things that we might find. So it's always simply a potential for what might come about from the work that we've done. And it's also, in my experience, it's hard for students to stay within the bounds of their study. Typically, students study small populations with very, very few variables. And given those constraints, it's very important that their potential for positive social change stays within the bounds of what they actually found. And they haven't found a cure for cancer or a way to stop war or whatever those big things might be. But hopefully they have added something to the literature that we can describe in such a way that it will have some potential impact for positive social change. So if we move on, I really want to get input from all of you. Bill, do you have that arrow again that you can insert for us? Thank you so much. If we look in the upper right-hand corner here, the Center for Research Quality is the abstract, has the abstract primer that will help all of us write our abstracts in a way that Annie's going to think highly of them. We hope. It's always my goal to have the abstract accepted on the first round, and gosh, that rarely happens. So something wrong with me, I'm sure. All right, so this is an excerpt from that primer, and what we're looking at here is the ability to make an important contribution to the literature. That's not enough. We have to specifically and clearly state what it is that we might have done or found that will have an impact on the world around us. I see Cheryl is typing. I'm anxious to see what she says. Okay.
Right. It's not a gap statement. It's not saying, well, I filled a hole. I've made a contribution. That's not what we're talking about here. More systemic thinking rather than a checklist. Did that. Right.
Right. It's about what's the potential now? As Amy said, what's the ripple effect? What might happen to the individuals that we studied, to their families, to their communities, to the systems within which they function? What might happen to the environment around them, and what might happen to academia in the process? So I think now, okay. So these are the questions that we might ask ourselves that will help us to help our students write more effective statements about positive social change. So who's going to benefit from this? Most often, go ahead.
I noticed we use the language will in this, which we have challenged ourselves to use may here. How specifically might they benefit?
Right. So who might benefit and how might they benefit should be the essence of your positive social change statement.
Does anybody have any questions so far? Or a contribution they'd like to make? I'm glad we're going to do group work, which Amy's going to introduce, but I realized in our process that our little team met for the 2 months before we presented in January about how we were going to, teach about this. And so we've come up with these 2 visuals, which we really hope you'll share with your students if you think they're useful. So the ripple effect, and then one we'll show you at the end. So please, consider sharing them. And I'm also very aware, and we've talked about how we probably can't get this kind of work out of our students through email chat, that it's phone exploration. What about this? What about that? Who, what, why kind of conversations might be the way to get there. And Amy's a dialogical faculty member, so we're going to use one of hers.
Thank you. Okay, so for the group work, we'd like you all to, if you can add your comments into the chat or raise your hand, we could try talking. We're not sure how that would work if you haven't tested your mic before, but so let's go with chat initially if we can. What I'm going to do is read an abstract of a student of mine that graduated recently, and her abstract was approved, but we haven't included the actual social change statements, to see if you all can come up with some of them based on what she provides in the rest of the abstract. So I'll just go, you can read along with me as I go through it. The title of the study was Landau-Kleffner Syndrome, an exploration of parent experience of the diagnostic process. This is by Donette Lamard-Reed. So Landau-Kleffner Syndrome, we'll call it LKS, is a rare childhood disorder that's often misdiagnosed as autism or childhood psychosis because of the overlapping symptom presentation. Favorable prognosis in LKS depends on early diagnosis and treatment. While much is known about the clinical basis for LKS diagnosis, little is known about parents' lived experience with LKS. To address that gap, the purpose of this study was to understand the impact of the parents' lived experiences with this process. Using a phenomenological approach and the medical model as a conceptual framework, semi-structured interviews were conducted with 7 parents of children diagnosed with LKS. Transcripts were coded, categorized, and then clustered into themes to describe the diagnostic process of children with LKS as experienced by their parents. From the parents' perspective, decreased LKS awareness within the medical community posed the greatest barrier to diagnosis. Lack of access to educational resources delayed diagnosis by hampering the parents' ability to effectively communicate their concerns to doctors. The delay in diagnosis resulted from physicians' inability to determine the diagnostic pathway because of unfamiliarity with LKS symptoms. Financial barriers were also present in the form of out-of-pocket costs for insurance plans with better access to services and providers. Parents were forced into the critical role of advocates in order to overcome these obstacles to prompt LKS diagnosis. Okay, so as you can see, there's quite a bit of information here, and there's only a little bit of space left for 1 or 2 statements about social change. So if you want to add your thoughts into the chat box, maybe you can read them off, and then we can let you know what the student actually did. I'll give you all a second to type. Judy Forbes, right? Decreased awareness. How about insufficient awareness? Good point. Could be. That's the wordsmithing that we and the chief administrative officer often helps a student go through.
So I'm challenging Judy to tell us, well, what about the so what part? What about the social change significance? Where might you start? Or if you were going to talk to the student, what would you ask?
Okay. So Donna's written, at the individual level, results may aid other parents of children with LKS to normalize their experiences. Good. Mary D says, who could use these results? Parents, doctors, health administrators? Good questions to ask. Yes, all of those could be influenced in this. If you're thinking about parents or the children themselves might count at the individual level. The doctors and health administrators might be at that peer, even into the community level. And Judy's typing. Judy's written a possible support group for other parents. Okay, so that's even an idea for action, I guess. Yeah, that could surely be considered in programs and initiatives. So at that level, that would be a good addition. Anybody else? Maybe we could get one or two more in, and then we can talk about what the student actually did and how she addressed many levels of that. Think of the concentric circles that I showed you. If there's anyone else that hasn't, maybe one hasn't been addressed at the academic research level or the community level as much. Mary D writes medical schools. Yeah, I certainly think that's one place that there needs to be more education done related to the difference between LKS and autism, for example. That would be a community level and very good. So Cheryl said, if we generated lots of ideas with a student, we could then decide which ideas would be best used in the abstract and which might be better for one of the sections of Chapter 5. Very good point, Cheryl, because here we only had maybe 2 or 3 lines on a Word document to actually sum things up. So it might be impossible to address all 5 of those concentric circles. And you might need to choose which is the most salient, the most important, just for the abstract itself, but you can go in more depth in Chapter 5. And as added, don't forget nursing programs. Great point, because a lot of young children come in and they're triaged by a nurse. They might actually spend more time in the office with the nurse, so they may be able to better see certain symptoms that are indicative of one kind of a disease or another. And the last comment we have here is to enhance the diagnosis and management of LKS among the healthcare community. Yes. It's obviously a community-wide thing that needs more attention, not just the families and the individuals themselves. I see 2 more. Facilities that deal with autism might help identify some who are misdiagnosed. Yeah, that's one of the ones the student ended up deciding to go towards, was this idea of misdiagnosis, wrongly lumping these kids with LKS into the autism spectrum disease. And then Wendy's added, the implications for social change include informing members of the medical community about LKS to improve diagnoses and parent experiences. Very good. That's pretty salient. It talks about our populations of interest, our stakeholders. It's not going out of bounds of who might be involved in this. Cheryl says, manage might then include insurance companies unfamiliar with the syndrome. Very good. Okay. Does anyone else have any comments? I think maybe it's a good time to jump forward and to show you what the student actually included. Anybody else want to add something before I do that? Just if you start typing, I can see that, but we'll move forward now. Okay, so this is the student ended up writing. These findings contribute to the existing literature by identifying barriers that prevent doctors from diagnosing LKS and informing initiatives aimed at improving doctors' ability to expedite LKS diagnosis. This awareness among physicians will decrease the social and economic burden of autism by improving the prognosis for children with LKS who would otherwise be diagnosed as autistic. So one thing I'd like to point out was a little bit different and didn't come up in all your comments was the student's ability to bring in even an economic burden, which is a more societal level issue, And she didn't focus so much even on, like, she made one comment about the patients and doctors themselves, and then she chose a second comment to go larger than that and discuss even a policy or a larger community identification issue that can go to the medical community, but it can go to the parents themselves not being able to speak up for their own children. LKS has certain symptoms that look like a child that has seizures and might have encephalitis, and then others that look like an autistic child. So my student wanted to make sure that she covered not just the individuals involved in her study, but made sure her findings went beyond that to change community awareness about this issue, because that's where maybe the most change needs to happen. Okay, let me get that. Cheryl's added the insurance issue. Yes, that was kind of the economic burden was getting at an insurance issue as well. There's sort of a critical window for LKS patients that if you can catch their disease and get them on the right medication, you can quickly get them out of having those symptoms. What they do is they lose the ability to speak and understand speech at an age like around age 4 or 5, just when they're starting to learn it and going into school. So if you can quickly identify them as these seizures are causing, there's like you have to do a special kind of EKG to see the issues that they're having, get them on the right medication, and then they quickly come back with their speech. So then they don't go down the line of path of an autistic child who gets an IEP in school, which is a specialized education plan, and they need occupational therapists and whatnot. So it's even just beyond insurance. It goes the whole system, the education system, the medical system could be affected by appropriately diagnosing these children early on.
Peter, I wonder if you could speak to Donna's point, because you didn't. I'd like to hear you talk about the boundedness of the study and how the social change statement needs to reflect how the study's bounded, which I think is part of what Donna's raising here about if we only sample parents in this case, how many claims can we make about significance?
If I could speak first, and then maybe Pete can go after. One thing I noticed as I read the abstract again is how many times the student says from the parent's perspective. And that was something the CAO asked for as well, was to not go out of bounds. Make sure you identify that this is just from the parent's perspective about this. But maybe Pete has more to say on that one.
Well, I think Donna pointed that out in her post in the chat room, that we're only looking at information from parents here, and of course this was approved all the way through to the CAO designee, and with the wording that this will decrease social and economic burden of autism, and of course we don't know that will happen, and this wasn't really about autism, it was about LKS. And so the real improvement there, we hope, would be about children with LKS, so that they would be correctly diagnosed and not bear an individual burden of losing their speech and undergoing a tremendous amount of therapy that wasn't going to be as effective as they could be treated with early diagnosis.
Yeah, very true.
Does that make sense?
Yeah.
I want to play.
Sorry, it's amazing to go back and read again. Right, that the idea of using will decrease is a poor use of wording. Yeah, put your arrow on there. Right. Will should be may.
Right.
These are always such a challenge for me.
To catch this all. Also, could one of us speak about what we heard Annie Pizzella talking about, that she doesn't require the same statement that the previous reader of these did, with a routinization of the sentence that started with, what did it used to be?
Sure. So it was me. I had talked to her at the national faculty meeting. The previous CAO had asked for specific wording being the implications for positive social change are, and it had to be positive social change just like that, or if whatever else you put in, it was inevitable that the CAO would add that into an abstract. So I just started advising my students to do it, but Annie was saying that she was getting quite bored of reading the same thing, and so she would be open for slightly different wording. But we had mentioned that makes it maybe perhaps harder for us because then we get into this kind of wordsmithing issue where we advise students to go broader and more interesting, but then they use words that go out of bounds of what their results really should be saying.
Yes, we were going to notice, we were going to challenge ourselves to say, hey, did our sample follow the old routinization, or was it a little more relaxed and fitting in the student's purpose? So,
this would be on the new. This would be under Annie's watch. This student that I have here.
Right.
Yes, and I'm pretty simple-minded, so I kind of like the old way, where you have to make the clear statement that, okay, this is the positive social change, because then as chair or a committee member, or you are, I know exactly what I'm reading. I don't have to intuit from something somewhere in here that the student is making a statement about positive social change. So this is a bigger challenge for me now that Annie is doing these.
So, and it creates opportunity. Go ahead.
I'm sorry, I was going to say, I do like requiring the words social change at least. I think that's a very strong thing about Walden dissertations, and so that it can set a student aside from other abstracts that are coming out from PhD students by talking about that. I don't think that's done in other schools as much.
Is there anybody here who has not ushered a dissertation through at this point? You might want to speak up and if you have any questions about it, but one of the things you'll find that Annie does is help figure out how to get it all into 250 words, into one page. So if she'll suggest a way to meet the criteria of the abstract and manage to get it all, particularly if she's suggesting adding something. So shall we move to the next?
Sure.
And I'm aware as I listen to what we say and what Wendy and Donna and they're talking about here is how much, again, we need to talk with our students and help them discern, what's in chapter 5, not write the abstract till they're all done with the dissertation, and then boil down that nugget, that sort of takeaway that's going to be in the abstract, but that does not define this kind of systemic thinking that we want our students to do. So I think when we talk about how many system levels are addressed in the abstract alone, it's very difficult to get, probably say more than 1 or 2 system levels because of the limitation on words, but that doesn't mean our students shouldn't be reflecting that in their chapter 5. And that good thought will probably lead them to a stronger abstract. Does anybody want to talk about non-significance? Has anybody bumped up against the problem of writing a social change statement when you have no results? And
well,
Peter's
yeah, that's a real challenge. It's a real challenge for a student. And as a matter of fact, I've had students ask me, well, will I be able to graduate because I didn't find anything? And so it's worrisome for them, and it's very, very difficult for them to wrap their mind around the reality that they still can say something about positive social change, despite the fact that they had no significant findings. And I think some of the easier ways, perhaps, to do that involve the academic circle. Because if there were no findings, then that means that whatever theoretical frame you used to capture the variables you were testing didn't work out. And so there might be a challenge to that theory. And there might be a challenge to what other researchers have found in the past. So the potential there might be at the academic level. It could also be at an individual level, because it could be, for example, that all of the hype and all of the time and energy we're putting into our exercise craze really doesn't make us healthier. And what would be more important is finding out what other 2 or 3 variables might be more meaningful. So it could be that there's a challenge there at the individual level or then an environmental level that is contrary to what other researchers have found in the past, and that can be positive social change.
Yeah, Judy just made a similar comment with her science-trained mind.
Yeah, there you go. Yep.
And Donna made an interesting point that just because it's non-significant doesn't prove the negative. When we make a null and alternative hypothesis, we're only trying to accept or reject that null. We can't just say it doesn't exist at all. You have to do the further study to prove that as a new null and alternative hypothesis.
Okay, I would love to hear if any faculty who are with us have had some successful experience in giving students feedback about this aspect of their abstract or Chapter 5. But let's move on, if anybody has something to add about that. So I think, we've covered a lot of these ideas before, certainly the idea of using, holding, making sure students are very aware that the checklist is their friend, and to use the primer and to start off with a really strong foot there, and then the visuals that we have to offer here to help them think more systemically. And clearly, if we could raise these points with them in their conceptual framework and their Chapter 2 lit review, they would be much better prepared to address these multiple systemic forces, because hopefully they would have combed the literature already looking at their problem from those different system levels. So here's some questions that we thought that you could consider asking your students, maybe early on in the proposal stage, so that they could begin to think about these things. Well, why is this research important? Why do I want to do it, besides just that I think it's really cool and I want to do this all of my life? So we could probably shape their preparation for this. And to be thinking about power, I hope all of our programs have, some course that helps them think about how to work the existing institutions in their fields, and therefore how the knowledge they're trying to generate might fit within that. And then, of course, there's conceptual frameworks like the tipping point theory that may be useful to help them think about how sure they can be in their tentative nature about what's going to make a difference.
Sorry.
So another Roger's theory of innovations is another guiding theory. Yes.
Well, I was just thinking about writing a prospectus, and in the prospectus should be enough information so that how to answer the who cares and so what questions. And from my perspective, if we ask our students to clearly identify those two things up front, it's going to help them down the line with these issues of talking about positive social change.
Yes. Wendy suggests that each program could have examples. I think exemplars of good abstracts might help that. And maybe some of these, like the significance section from Chapter 1 and 5, might also help sort of expand their mind that the abstract alone probably can't teach what we want in terms of systemic thinking successfully, and how to craft a word choice to accomplish this. Okay, and also this is the thing, is that we use this phrase positive social change, but we certainly want to help students be aware of the negative consequences of change, and that to be cautious of that. To be responsible, like our physicist was, if you're going to matter, if you're going to work with issues like matter and energy, and be able to invent bombs, you have to take responsibility for the knowledge you generate.
Donna makes a good point in here about discussing the possible weaknesses of design and measurement and sampling, and especially for the non-significant findings that can sometimes explain why error has been introduced in the study, and perhaps if we use stronger methods the following time, our results may prove significant. I would like to just note that those issues are often discussed in the limitations section of Chapter 5, and then you can use the recommendations for future research. I have my students, if they have a limitation, in those recommendations, make one that will counteract that limitation you have for the next one. So if it's my sample size was too small, then your next future recommendation would be have a larger sample size. My scale that I used didn't have good internal reliability. I'm suggesting using a different scale next time. And for those students that have non-significant findings, that is sometimes where those recommendations for future research and the limitations section is often where they draw an idea for implications for social change, because it points to weaknesses that we already know about in the academic field of research. And so you can make those suggestions for other academics, I'm losing my English words sometimes. And that we have a difference between making recommendations for action for the population, the sample population, and the community itself versus academics. And I think most of the time my students that have non-significant findings can only speak towards academics.
Right. I want to point out this one thing on the screen about disseminating their ideas. So I can pitch that we spend a lot of time on the phone or on Skype with our students, but if we send them out just to talk about their study to other people instead of start informal dissemination, they're probably going to get responses from other people about the importance of their finding or the ways it might be applied, and that would be another way to get them thinking about multiple stakeholders and multiple system levels. So Wendy said, we've been talking about exemplars, and Wendy says that her program has exemplars that are sent to all the URs and shares, encourage them to send to students. So that's an excellent idea, that while there are few exemplars in the abstract primer, there might be one specific to our schools that would be even more helpful to students. Wendy, you can email it to us. We can mail it to everybody else. So here, just as a reminder about, also this is an exercise maybe from dialogue, is to remind the students, who are you writing for? Well, you're writing for your committee and the URR, and definitely that CIO reader, possible people in your discipline. And so that might help sharpen their thinking and get them away from grandiose thoughts, that it's because this audience is not looking for grandiose thoughts.
I think one of the other important things to tell our students in this regard is that each of the audiences is going to bring a different perspective to their reading of the abstract or their chapter 1 or their chapter 5, so that students understand that if the committee member would like to see statements about positive social change written differently than the chair suggested, and the URR now wants to see them written differently than the chair and the committee recommended, and now the CAO wants to see them written differently than the chair and the committee and the URR agreed on, that's a normal part of the academic process. It's not that anyone is necessarily right or wrong, it's that people bring a different frame of reference. And as you move through the process, that new frame of reference is going to impact the student in terms of the audience they're writing for, and therefore changes they might need to make in their writing.
So we
and with the goal of
5 minutes here, and we want to take you to this last image. We're missing our colleague Amy Sickles. She couldn't come tonight, but she was big on helping us with these visual images. She uses this with her students in psychology. Amy, you want to talk about it a little bit?
Sure. This is another tool you could use with your students. It's another way of visualizing what would go. This is more about what would go in the entire abstract. and it's a funnel that we start big and talk about the overall problem. In psychology, they think about the 4Ds: death, disease, dollars, and disability. It might be different from whichever school or discipline you're working in. And then you're going to focus a little bit more, talk about a gap in the literature and the specific theory you'll use to ground your study, go into the problem statement and purpose, and the specific research questions and hypotheses that were examined in the study. Sometimes the variables and themes of interest also need to be distinguished. Then you're going to go into the overall methods and the specific design used in the study, talk about the population sample, who was involved, what are the results, and analyze the data, and what are those, the statistical findings, or if it's qualitative research, what were the major themes. And then where our lovely social implications for social change come back into play is in the discussion section. So our funnel comes down real narrow, and the implications should bring it back out wide again and tie back into what's going on. How is this going to impact something beyond just a dissertation that's going to sit on a bookshelf? And hopefully there's a plan for action that can come out of this. So yeah, if the concentric circles don't help, this might be another way to help organize the abstract to make sure you have enough room for that discussion section in the end.
So Judy's asking for, you're making us happy, asking for the visual. So you will get the PowerPoint, but this is a funny shape. I think we could send you a Word document with the 2 visuals. Something easier to send to students so that you don't have to send them the whole PowerPoint. Does anybody want to give us feedback about this image? If you think, well, with this kind of image, good. Wendy likes it. Help our students see they don't have to do the whole thing like Mary D said and make grandiose statements that only about that alignment with the data that they analyzed. So, Mary D likes the concentric circles, right? With a nice image of the ripple effect, right? So with just,
I have a theory about who likes which one. I don't know, maybe we can ask is who's left-handed and who's right-handed, because it might have something to do with your left brain and right brain. Do you think linearly, or do you think sort of in a system level? Too bad we can't have a poll.
So,
what happens if you're ambidextrous?
You probably like both.
So somebody asked, well, okay, what does Walden really mean by positive social change, which we as scholars better be asking. So here's a link to the report that was made by a team that Ira Jo pulled together to look at how it's defined and how that crosses our disciplines. So this will help you with this, and it might be that you would want to share a resource like that with your students to get them thinking about what we mean about that. And that is it. And if you read our PowerPoint, you can read, we have 3 other sample student social change statements that you could look at just as examples or something you might want to share with your students, although they're missing the full text of it. But I like the idea of each of our schools providing examples. So if we have 5 more minutes, anybody have any questions or final thing that they want to add besides that the visual images work, which make us feel good? That came out of our process. I think it took us 6 weeks of talking, in a headier way about this before we got together and started to see that we could provide a picture for it. So is there anything you might do differently, having spent time with us, or could you point us to people for whom this might be useful, or something that we should take away from this ourselves as workshop leaders? Wendy would like to see the examples. We would not let an abstract go through the list of social changes filling a gap. You think you saw one that said it was a gap statement, huh? Contributed to the existing literature. Okay, now we saw that one. Let's go ahead to that's the LKS one. Right, Wendy, you wanted to see one of the other ones, right?
Wendy, I think the reason simply filling a gap wouldn't fly as social change is because we're asking our students to think beyond that. Filling a gap is a simple fundamental requirement for conducting dissertation research at Walden. Once you've filled that fundamental requirement, then the potential for positive social change needs to go beyond that. You need to be asking a question that is about a real world problem that is worthy of research and that can lead to the potential for positive social change. So those are all beyond simply filling a gap. That's not enough at Walden. It might be enough at a whole bunch of other universities, but it's not enough here.
Now, so this Hoffman one, you know, we don't see the whole study, but this was approved, but it misses an opportunity, it seems, to say increasing whose awareness. So who are the stakeholders here? And, but it doesn't, it's not just filling a gap. It's about action, but it's a little ambiguous what the action might be. So awareness of the impact, well, what, if they had more awareness, what would they do? So I might push to extend this one a little bit more. Okay, well, we appreciate the hour that you spent with us. We're delighted. We had 3 times as many people come to this as we did at the when those administrators gathered at the annual faculty meeting. So we figured that you were indeed the audience for which we had prepared this ourselves. Thank you, Teresa. Thanks, Greg.
Thank you, everyone. I'm also curious about what we can do to make something like this better. So if you have suggestions for us, please let us know.
Okay, so you'll expect to hear from us because we promised you the Word doc images, and our facilitator here will be sending you the PowerPoint within a day or 2. Good evening.